Welcome to this video. In this video we're going to talk about psychosomatic illness, which is an extremely important topic in medicine, but it's also an extremely controversial topic in medicine. And the reason is that the psychosomatic theory, which we're going to discuss in just a moment, is not yet proven. It is just a theory, and there are many people who believe that it is an incorrect theory. However, it is still the best theory that we have at present, and therefore it is the theory that is used by many practicing clinicians, so it's an important theory to know at present. And it may well turn out that it is proven to be correct, or it may well turn out to be proven to be incorrect. We don't know at present, but it is at present our best theory. So, before we get into the main bulk of the video and explain what the psychosomatic theory actually is, let me say that there is another word for psychosomatic. In fact, there are many different words that can be used equivalently to psychosomatic, but the other big one is functional. And that's come out blue for some reason. Let me see if I can change that colour. There we go. So functional illness means the same thing as psychosomatic illness. And in fact, I would say, at least in the UK, functional illness is a more commonly used term than psychosomatic. So very, very important to know the name functional means the same thing as psychosomatic. So let's now go into the bulk of this. What does the psychosomatic theory say? So I was debating the best way to actually explain this. Is it to leap in and explain what the psychosomatic theory actually says, or is it a better idea to give a little bit of the background as to where this theory comes from? And I've decided to go for the latter, to give you a little bit of the background as to where this theory actually comes from. So here we go, here is the background. So anyone who actually has a clinical role knows that a huge number of patients, we can't ever actually find anything physically wrong with them. So let me go into this again. So there are a lot of people who have symptoms that are suggestive of physical illness. They go and see their doctor agrees that these symptoms are a little bit worrying and does some investigations for them to try and find out what might be the cause of this, and then all of the investigations come back normal. So the doctor might then say, okay, let's do some more investigations, some higher investigations, just to make absolutely sure. They have to go and have those investigations done, and again they come back normal. And maybe they might even go beyond that, do a third set of investigations, more and more advanced tests, and those all come back normal. And eventually we will conclude that there isn't anything physically wrong that is causing those symptoms, or at least at the current level of medical knowledge, there is nothing that we can detect that is physically wrong to be causing those symptoms. There is a name for this, and it is medically unexplained symptoms. This term isn't used that often, but you do hear it sometimes used in a clinical environment. So medically unexplained symptoms, MUS for short. So let's give a concrete example. So the main example probably of medically unexplained symptoms is usually in the gastrointestinal tract. A lot of people get gastrointestinal problems that they are concerned about. They go and see their doctor to make sure that they don't have anything physically wrong with their intestines, and all the tests say that their intestines are perfectly normal. So let me give you an example of a very, very famous, very, very common gastrointestinal disorder that follows this pattern where we cannot find anything physically wrong, and that is irritable bowel syndrome. Whoops, that's not it. Syndrome, or IBS for short, which is not to be confused with IBD. IBD stands for inflammatory bowel disorder, and that is an inflammatory condition of the bowel. If you do tests for that, you can find something very, very wrong with the bowel itself. It is not an autoimmune condition, but it's very similar. It's believed to be a failure of immunological tolerance to the commensal organisms within the gut. So it's a well-known fact that our intestine is full of bacteria, and these are good bacteria. They help with digestion. And the immune system is supposed to not attack those bacteria. It's supposed to ignore them. It's supposed to have tolerance to them. In inflammatory bowel disease, we believe that there is a problem with the immune system that means that it fails to ignore those bacteria and starts attacking them. And this leads to a massive inflammatory reaction in the intestine that causes huge problems for the individual. So that's inflammatory bowel disorder. That is not a psychosomatic condition. That is a physical condition of the bowel. Irritable bowel syndrome is different, IBS. It is one of the biggest examples of what at present is classified as a psychosomatic condition or a functional gastrointestinal disorder. So let me explain what happens in individuals with irritable bowel syndrome. It is believed to be a condition of the colon. So let me just start by drawing a little picture of the colon, and this is going to be a very basic picture. So here is the ascending colon. Here is the transverse colon, the descending colon, the sigmoid colon, and then the rectum. So very, very basic picture. Now, the colon is normally moving around all the time. It's wriggling around like a worm. So it's never stationary usually. It's usually moving around a bit. Imagine a worm wiggling around. That's its normal movement. And it achieves this movement by small, short-lived contractions of the smooth muscle cells in the wall. So remember, the wall of the colon, it has smooth muscle cells in it, and these cells can contract down for short periods of time. And if you imagine loads of those smooth muscle cells contracting and relaxing all the time, this is what produces that writhing movement of the colon. However, those smooth muscle cells can produce something called a cramp, a colonic cramp. And this is what is believed to happen in irritable bowel syndrome, so a colonic cramp or an abdominal cramp, because that's what the individual who experiences this is going to feel. So imagine for a second that all of those smooth muscle cells in the wall of a section of the colon were to contract completely down. What would actually happen to the colon in that case? Well, remember, and I'll draw another picture now. Remember, the smooth muscle cells are arranged in circles. So if this is the colon cut transversely, and I apologise for the poor picture, I am using this kind of like a interactive whiteboard at present. I have it propped up and I'm drawing in a way that I haven't done previously, which is why I'm a little bit unsteady. So here is a transverse cut of the colon. So this is the wall of the colon, this is the lumen of the colon. And the smooth muscle cells, and I'll just try and draw a little one in red here, they are those spindle-shaped cells, so that can be a tiny little smooth muscle cell there, that are in the walls of the intestine. And remember, they're arranged in circular formation. So this is one, but it will be attached to loads of other ones that will be in this position, and another one in this position, another one in this position, and they form like these rings of smooth muscle cells that are connected to one another. Now, normally they contract, they have small little contractions that end very quickly and they go back to their original size, and this is what produces the small little movements that, when you have them all over the place in the colon, produce this writhing movement. What would happen though if I took a section of colon, let's say I take this section in the horizontal transverse colon here, and I was to make every single one of the smooth muscle cells in this section here contract at the same time, right down? Well, because they're arranged in these circles, every single smooth muscle cell would get shorter, and because they're arranged in the circles, the circumference of those circles would decrease. And you know basic geometry, or you have basic common sense. If the circumference of the circle decreases, the diameter decreases, and therefore it's going to contract the lumen of the colon right down. So it will contract down and squash the lumen right down. And that's what can happen in a colonic cramp. That is what we mean by a colonic cramp. There's another name for it actually. You can also call this a spasm. Let's see if I can alter this. I can. So a colonic cramp / a colonic spasm. Now, when that happens, and I might just draw, so this section of colon might now contract down to a size like that. that I've drawn in red. So imagine the white colon was the size of it previously. When all of the smooth muscle cells contract down, the section might contract down to that small size there. And I might try just rubbing out, oops, that's not going to work, rubbing out some of this other stuff here. So you can imagine that that section of bowel now has contracted down to that small little size there now. So you've got a section of the colon contracted right down. That is what we mean when we say a colonic spasm or a colonic cramp. A spasm in the colon. Right, and that can last for a long period of time. Those smooth muscle cells can remain contracted right down like that for a long period of time. That is extremely painful when that happens, and the individual will feel that as an abdominal cramp. Horrible, horrible, debilitating pain in the tummy. And this is what happens to people with irritable bowel syndrome. They get colonic cramps for unexplained reasons. Now, colonic cramps, what is the point of colonic cramps? You do get colonic cramps because of organic illness. If you have really horrendous infection in the bowel, let's say you contract Shigella, some horrible bacterial infection, you go to some country where cooking conditions aren't as good as they are in the Western world, and you contract some horrible bacterial gastroenteritis that infects your colon and causes massive inflammation. When you have massive inflammation in the gut, that's when the colon actually can go into a spasm for a decent reason. And the reason it will go into a spasm is to try and push contents that might contain the infectious organism out. So colonic cramps or intestinal cramps, because you can get small intestinal cramps as well in the context of an infection or inflammation, they are supposed to happen in response to inflammation, and that inflammation could be due to an infection or it could be due to what we've just talked about with inflammatory bowel disease. So inflammatory bowel disease can also cause colonic cramps. However, in individuals with irritable bowel syndrome, they get colonic cramps, and the cramps are, we think, limited just to the colon in irritable bowel syndrome. They get them for no reason. We can't find a reason, a physical cause of why they should be getting those cramps. The colon isn't inflamed, so we would call this a medically unexplained symptom. So in individuals with IBS, just to summarize what we've talked about, they get these colonic cramps, idiopathic colonic cramps, and they don't necessarily always have to be the same section of colon. They could be different sections of colon, and these are extremely painful and really, really painful. People with IBS can be bent over with these horrendous pains. It can be really, really debilitating. Also, along with the cramps, because the cramps push fecal matter either forwards or backwards, it can also result in either diarrhea if it pushes the contents forwards, or it can result in constipation if it pushes it backwards. So imagine the colonic cramp was down here in the sigmoid colon. You can imagine that if that pushes it down into the rectum, that's going to produce the need to go to the toilet extremely rapidly, and most likely result in a bit of diarrhea. Whereas if it pushes it backwards, you can imagine then that it's going to take quite a while to move it back downwards, and more water will be absorbed in that time, and therefore it could result in constipation. So IBS is a disorder characterized by idiopathic colonic cramps, and then because of these colonic cramps, they get horrendous pain when they occur, and they can get a mixture of either diarrhea or constipation due to this. So this is an example of a condition where the symptom is medically unexplained. We don't know why this is happening. We can't find a physical problem with the colon that is causing this. And this is the sort of condition where the psychosomatic theory came from. So now that we've given that as an example, and there are loads of other examples of this, by the way, there are a whole bunch of other what we classify as functional gastrointestinal disorders that I'll talk about later on once we've gone through the psychosomatic theory. So let's now introduce this major theory then. So let's just go down, get a little bit more space. So we now want to discuss the psychosomatic theory. We've given a little bit of the background, we've talked about medically unexplained symptoms, we've given an example of a disorder where we can't find a physical problem. Let's now talk about this theory. So, We know that the brain controls the entire body. The colon responds to neurological input. It has a huge number of neurons innervating it, and those neurons are obeying orders from the central nervous system. The central nervous system controls your heart rate, it controls when you go for a wee, it controls when you go to defecate, it controls your sweating, it controls all sorts of things. The brain really does control the entire body. It controls your breathing. Nearly every part of your body is innervated, and therefore the brain has control. And we know, because the brain controls the entire body, that neurological conditions can cause symptoms all over the body. And a big example would be the neurological condition multiple sclerosis, MS. So I'll just write that down for you as well. So just a little example here, multiple sclerosis stands for, is often abbreviated to MS. So, for those who don't know much about multiple sclerosis is an autoimmune disease of the central nervous system, the brain and the spinal cord. It is an attack that is against oligodendrocytes, another big word, which I'll write down for you. So the autoimmune attack is believed to be directed against oligodendrocytes. Now, those are the cells that are responsible for producing myelin sheath that myelinates neurons in the central nervous system. So remember, Schwann cells, they myelinate neurons in the peripheral nervous system. In the central nervous system, you don't have Schwann cells, you have these different types of cells called oligodendrocytes. Now, in multiple sclerosis, for some horrible reason, the immune system decides to attack oligodendrocytes, and this causes a massive, massive problem. Now, the one small mercy of multiple sclerosis is that the immune system doesn't attack the entire brain all at once. I don't know why it doesn't do that, but it doesn't. It attacks small sections of the brain and tries to destroy the myelin that's created by the oligodendrocytes. In fact, that's a further point. It's not against the cells themselves, it's against the myelin that the oligodendrocytes produce. There's something about the myelin that oligodendrocytes produce that the immune system really doesn't like in MS. And it doesn't attack the myelin of the peripheral nervous system, it's just the myelin of the central nervous system. And biomedical scientists are working very hard to try and find the reason why that is, but we don't know at present. So, anyway, back to MS, back to what is known about MS. So, it doesn't attack the whole brain at once, so you don't get panencephalitis with the whole brain becoming inflamed and then under attack. Instead, you get small lesions where the autoimmune attack is working. So if I draw a small little picture of the brain, and we'll go back to using white rather than, whoops, that's far too big. So, excuse this bad picture of the brain. So this is a very basic, awful picture of the brain, but it will do. So in MS, they get small white matter lesions. So you might have an attack there, you might have an attack there, you might have an attack there. So they get spots in the brain where the autoimmune attack is active and the myelin is being destroyed, rather than the entire brain becoming inflamed all at once. Thankfully, that doesn't happen. You just get small patches that are being attacked, and these are called white matter lesions or white matter plaques. Now, the bits that are attacked are going to misfunction following the autoimmune attack, and this can lead to symptoms all over the body because depending on the different part of the brain that is attacked, it will affect a different part of the body. So MS is a really heterogeneous disease. Everyone is affected differently by MS because it depends on where the white matter lesions hit. Anyway, the point of this little diversion into discussing MS is just to explain that people with this disorder can get problems all over their body. They can get horrendous constipation, they can get urinary incontinence, fecal incontinence, urinary retention, massive problems with the bowels and bladder in particular. They can get problems with their heart rate, problems with strange sensations and pain all over their body. So, and it depends on where the lesions affect within the brain, what symptoms they will end up with. So the point of saying this is just to prove to you that here is a neurological condition, a condition of the brain, not a psychosomatic condition, very much so an organic condition, a problem that we can detect on a scan that is causing symptoms all over the body. The psychosomatic theory is that psychiatric conditions, which of course are also conditions of the brain, but far less well understood conditions of the brain, they're not conditions that we can do a scan to diagnose. If you scan the brain of someone with depression or even someone with schizophrenia, it looks pretty much exactly the same as someone who doesn't have those conditions. The psychosomatic theory is that psychiatric conditions can also result in symptoms all over the body. After all, they are conditions of the brain. The brain controls the entire body, and therefore, just like neurological conditions can cause symptoms all over the body, psychiatric conditions can cause symptoms all over the body, and these symptoms are then called psychosomatic symptoms. Psychiatric conditions causing somatic symptoms, and that is what we think is happening, or at least that is what this theory says is happening when we have people with medically unexplained symptoms. So for instance, irritable bowel syndrome, we believe, or this theory speculates, that these individuals also have coexisting psychiatric issues that is causing the problem with the colon, that is causing these cramps in the colon, i.e. the psychiatric condition is resulting in this somatic problem. It's resulting in bad stimulation to the colon that causes these cramps. And other psychosomatic conditions, and we will go over some other examples, so we'll look at CFSME, fibromyalgia, two other big examples, other functional gastrointestinal disorders. The hypothesis of the psychosomatic theory is that these are being caused by an underlying psychiatric condition that is resulting in incorrect control of the body by the brain, and therefore is resulting in these problems somatically. That is the psychosomatic theory. So we'll have a break here, and in the next video we'll talk about this more.